Hello, I'm Dr. Dalaya. I'm the founder director of Nityanand Rehabilitation Center. I have done my post graduation in MD Psychiatry from BJ Medical College. After completing my post graduation, I was a consultant psychiatrist in the topmost 5 institutes of Pune, namely Ruby Hall, Pune Hospital, Sahyadri, and Pune Institute of Neurology. I've worked in these multi-speciality hospitals, institutes for 5 years. And after working there for 5 years, I realized that there were a lot of limitations in the way psychiatric treatment was done. And it was only a single psychiatrist doing most of the things, which was very difficult because psychiatric illnesses have a longer convalescence period. That is, they take a long time for recovery, and treatment should be geared up not only by medication, but psychosocial services play a major role in recovery. Hence, understanding the limitations of a multi-speciality hospital, which was very costly, and so we decided to have something which was cost effective and covered all the 3 areas of treatment, that is the biological treatment, the psychological treatment, and the social treatment. And if all three combine under one roof, then we can deliver services in a specialized team manner, and the best results could be achieved by doing this. Nityanand Rehabilitation Center was a pioneering effort which was started in 2000, and we completed the first project at Kathraj in 2002. We started this project with the sole intention of giving all the biopsychosocial services under one roof for all patients who suffer from chronic mental illness and addiction. Initially, because the center was established in 2002, now let me give you a brief overview of the kind of infrastructure. Today, we are 2 centers, one in Kathraj and the other in Pachane, which is Pachane is out of Pune corporation limits in a scenic location besides a lake and surrounded by mountains. Now, when I initially started Kathraj Center, we started with a 30 odd beds facility. It's more of a building setup with no outdoor games or facilities to play outdoor games. These limitations were realized after a while because the indoor stay is anywhere between 3 to 6 months. Now, Kathraj is a building setup with about 150 patients indoor capacity, with a separate dining hall and a vocational as well as a group activity area. But because of excessive need and excessive demand from patients for a more of open setup with lots of play area, as patient had to stay for a long time here, we took the initiative and started the Hinjawadi setup, which is spread over 16 acres of land and independent blocks for each illness. We have 4 independent blocks for indoor stay, plus lush green gardens, lawns, and a lot of open space for patients to move around and have outdoor games. We have a separate vocational as well as activity play area. We have a small mini theater for entertainment. All this together actually makes it a facility like home away from home. We are indoor capacity of 300, plus we're going to expand another 200 beds. Now, the treatment is mainly chronic mental illness, by which I mean to say that we are specialized to treat schizophrenia, bipolar mood disorder, mania. We have a lot of schizo-obsessive patients, indoor admission. Now, the protocol as such for treatment starts with a working diagnostic formulation is done. After the diagnostic formulation is done, the right kind of medication is decided by the team of experts, and the patient is started on the medication. Initially, for the medication to act, it takes about 4 to 6 weeks. After the first 4 to 6 weeks of treatment, most of the patients show good symptom control. Parallelly, the psychologist is working on his behavioral problems, as well as a contracting is done with the patient that he has to stay here, designed within the first 4 to 6 weeks. After the therapeutic plan is designed, the psychologist independently works on issues which are related to illness as well as related to the family. The doctor does the symptom control as well as facilitates minimal medication with minimal side effects and best symptom control. All this takes about 2 to 3 months to have come to a stable phase wherein the patient is able to appreciate, understand, as well as becomes slightly more insightful about his illness and starts accepting it, that he has a problem and that he needs to deal with it. Once that phase is done, the second phase starts, wherein he has to be actively involved in the process of recovery, wherein we put them into, we give them role plays, we give them psychodramas, and then some people start leading the group, they become group leaders. And with all these activities, what we are effectively building is all those qualities which the illness, because of the illness, which are lost, we try and rebuild those qualities, rebuild that patient's confidence that I can do something on my own. And once he starts believing in it, we give them small roles and responsibilities. In the vocational training workshops, we have a lot of activities being done, like candles, bags, paper bags, then jewelry, different types of jute bags. So all these activities keeps the patient engaged, and the second and most important thing is he feels self-worth. Now that self-worth is very, very important, because unless and until the person feels that I'm able to do something, he doesn't get into the recovery process. Similarly, addiction, the same is done in addiction. They have a very fixed schedule, like from morning 8 o'clock or 7 o'clock with high tea and yoga, that their day starts. And all throughout the day, there are input sessions, there are output sessions, there are sharing sessions. There is some vocational workshop, and all this put together, they spend their day from morning 6 o'clock till evening 7 o'clock. At Nityanand, now let me explain you the treatment protocol as well as the therapeutic model. Treatment of the patient. 2, the family becomes much more educated and aware about the illness, and we want the family to be empowered to deal with this person who has mental illness or has addiction, and in a much more better manner. So we lay equal importance to family therapy and family work. Now what I mean by family therapy is that each time the patient's family comes to visit the patient, they talk to him, they spend some time with him, and interact with him, and they meet with the family, and we do a proper assessment review about what they feel, how much better they find the patient, and address their issues and questions, and then draw a realistic plan of management. Because each person would have certain difficult gray areas and certain things which would be better. So it has to be designed and tailored according to the needs. So mainly the family meetings are conducted for the family to become much more empowered to deal with this reality, and we educate them of how in the best manner they can deal, how not to have too much of expressed emotions, how to tactfully handle a situation, what are the warning signs of relapse, how relation regarding side effects. So in toto, what we effectively are trying to do is, if the patient is in a process of recovery, I think the family also should be empowered with knowledge and with inputs, so that they become much more it becomes much more comfortable and easy for them to deal with the patient and put him on a therapeutic track wherein he goes back to the mainstream. So Nityanand lays equal emphasis both on recovery and family education. And the most important thing is that recovery is a process and it's not something which happens overnight. In recovery, the patient has to become much more insightful and has to accept the illness. Unless and until there is insight in the patient that I have a problem and that I need to deal with it, recovery cannot be consistent. And good symptom control and good, insightful, aware, educated patients is the key for long-term recovery. 21st century and has its own advantages of modernization and IT companies coming up, everybody very tech friendly, has its own impact on the new generation. Today's generation, child has become one of the most difficult to deal with situation, solely because both parents working, long working hours, a lot of travel abroad. Now that becomes very difficult for the family to put in effort on a one-to-one level and see what the child is, how the child is faring. We're starting a child guidance clinic in the same place, in the new center. The child guidance clinic is going to be one of its kind, wherein there would be a separate assessment area, wherein all kinds of psychological testing material will be available, so that we are able to identify what all are the gray areas in each child. Childhood is a state wherein, right, a stitch in time would save nine. So early identification and early treatment is our goal, and if we are able to achieve that, we would be able to stop a lot of problems which appear in adolescent and early adulthood. Our child guidance clinic would have remedial, vocational, and difficult cases or diagnosed cases. Also, we would have groups for parents, how to handle this child, and all kind of remedial as well as vocational as well as group activity for specially able children, like dyslexias and any kind of neuropsychological disorders. We would also have physiotherapy, vocational trainers, remedial teachers, and special educators. If you have any queries or any information required, log on to our website www.nityanandrehab.com. Thank you.